I'm Alyssa. I'm a physical therapist assistant. I'm going to work with you today. Is that all right?
Yep.
And then we also have Trevor. He's another physical therapist assistant. He's one of my coworkers, and he's going to work with us for this session today, too. Is that all right?
Yep.
All right, so the first thing I'm going to do is I understand that you have had a shoulder injury and you're experiencing some pain. Can you tell me a little bit about that?
Yeah, like it's my right shoulder, and I just have been having pain. It started Monday, like around the morning time, and it's been there for a week. Last weekend I did a lot of like scraping and painting of my house. I redid my whole outside type of thing, and yeah, it's been there for a week, and it just aches.
On a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain you could possibly experience, what would you rate your pain?
Probably like a 6.5.
6.5. All right, and then do you experience any numbness and tingling down the arm, into the fingers?
No.
Perfect. And then would you say that the pain is like a sharp shooting pain, a dull ache? Does it get better with some positions and worse with others?
I would have to say it's an aching pain. It's definitely aching. I mean, it just bothers me all the time, and like when I lay on my bed, like when I'm trying to go to sleep, I like to lay on my right side, but I can't even lay on my right side because it hurts so much.
Okay, and then what is your job? Do you do a lot of painting and scraping, or is that kind of a one-time thing to redo your house?
No, I'm a mechanic, so I'm definitely, like, we have the cars up on the things, and we're just doing a lot of that stuff.
So a lot of like laying on your back, lifting things up, and then laying on your side and such.
Yeah.
Alrighty, sounds good. So the first thing I'm going to have you do is I'm going to have you stand up on the side of the bed. Before I do anything else, I'm going to wash my hands real quick before we get started. Alright, perfect. So the first thing I'm going to have you do is we're going to kind of see what your range of motion is with all of your joints. So first I'll have you raise your arms up overhead like so. Alrighty, good. You can go ahead and bring them down. Now I'm going to have you bring your arms out to the side like you're making a snow angel. Alright, good. And then next I'm going to have you bend your elbows. Bring them back out. Good. We'll do the same thing with our wrists. So we'll bend our wrists up and bring them back down like so. Perfect. And then I'm going to have you bend your elbows. And we'll, keeping our elbows at our side, we're going to bring our wrists towards our belly button. Good. And then from our belly button, we're going to bring our wrists out. Good. Alrighty. Any pain with any of those motions?
Mostly just the whatever you did up here and the snowflake one.
Oh, the abduction inflection?
Yeah.
Right out in front of you?
Yep, those.
Alright, I did notice that that was a little bit limited with range of motion, but we can fix that throughout the session today. Alright, Michelle, if you can go ahead and look forward for me. Perfect. Alright, so I just gave a quick assessment of your posture. So posture is really important in patients with shoulder injuries. So the first thing I noticed is that your shoulders are kind of rounded, so they kind of appear like this. It's hard to notice after someone has been in a posture like that for so long. We don't really notice it because it becomes habit.
Yeah.
But what I would like to do is I'm going to have you bring your shoulders back and kind of bring your chest out. Good. Do you feel how that has opened up your chest muscles and your back?
Yeah.
All right, perfect. It's important that we try and correct that because tight rounded shoulders can decrease shoulder range of motion, bringing your arm forward. So I did notice that you were limited in that motion. So hopefully by correcting your posture, that will help. And it will also help with the back and shoulder pain. Alrighty. So the next thing I'm going to have you do is I'm going to have you take a seat and on the table. And now I'm going to use this device. So this is called a goniometer. So what it's going to do is it's going to measure your range of motion. So I just ran you through that range of motion screen that we were doing at the beginning. Now this device will kind of help me get a very accurate representation of it. So first I'm going to start by measuring your good arm. So first I'm going to bring this over here. So the axis for measuring shoulder flexion is going to be the greater tubercle. So is that all right if I palpate or feel your shoulder?
Yep.
Alrighty. So I'm going to feel until I find the greater tubercle. Alright, and then I'm going to have you bend your elbow. And then
like
can
this?
you perform, yep, down to 90 degrees. So we'll go right here. Then can you bring your wrist towards your belly button and out?
Okay.
Good, thank you. Just want to make sure I'm on that bony landmark. So the axis of my goniometer is going to be on that greater tubercle.
Okay.
And then my stationary arm is going to be parallel with your body, like so. And then next, what I'd like you to do, Michelle, is I'd like you to straighten out your elbow and raise your arm up in front of you.
Like this?
You got it.
Okay.
Alrighty. So I got 170 degrees, which is good. Yep,
Okay.
that's good.
This one probably ain't gonna be that good.
Maybe not. We'll see. All right. So again, I'm going to palpate from the clavicle out to the greater tubercle, and then can you bend your elbow again for me, please?
All right.
Good, and then bring your wrist towards your belly button again.
I like this.
Yep, and then keep performing that motion, please.
Like this?
Like internal, external rotation.
Okay.
Good, this will help me find the greater tubercle. Perfect, all right, this is where my axis is gonna go. Stationary arm is again parallel with the body. I'm gonna have you straighten out your arm, your elbow, Michelle. And then go ahead and raise your arm up as high as you can. All right, and can you go any further?
No.
No, all right. And I measured 133 degrees.
Is that good?
So it's pretty good. We are a little limited because remember your other shoulder was at 170 and now this one's at 135. But hopefully with some of the exercises that we do and also some of the mobilizations that we're gonna do will help increase that range of motion, and over time, I hope it gets better. I suspect it will.
Awesome.
So then the next way I'm going to measure is we're going to measure shoulder abduction out to the side like this.
Okay, the snowflake thing?
The snowflake thing, you got it. So again, I'm going to start with this arm. So I'm going to line up my goniometer. The axis is going to be on the top of the acromion here. So we'll palpate out. All right, good. And then my stationary arm is going to be, again, parallel with the body. And so then, Michelle, what I'm going to have you do is I'm going to have you keep your elbow straight and raise your arm up out to the side like you're performing a snowflake. Good. And then the movable arm is going to be in line with the midline of the humerus. Good. And I got 176 degrees. So that's good.
Okay.
Now I'm gonna test this right side.
Again,
So
probably ain't gonna be that good.
no, but we'll find out. We'll see what it is. So I'll have you bring this arm out to the side. I'm gonna again palpate for the anterior acromion. All right, here's where my axis is gonna go. Stationary arm again parallel with the body. Movable arm at midline of the humerus, and then I'm going to have you raise up your arm again, keeping the elbow straight. And then is that as far as you can go?
That's as far as I can go.
Alrighty. I'm at 137 degrees. So a little limited compared to the other side, but again, through exercises and other things that we're going to perform, hopefully we can improve that. All right, Michelle, now that we're done with the range of motion that I used our fancy goniometer for, now we're going to manual muscle test you. So all that means is I'm going to test the muscles that perform the two motions that you are limited in. So that is the first one, shoulder flexion, so raising your arm up out in front of you. And then the next one is shoulder abduction or our snowflake motion.
Okay.
So I'm going to test both of those and see how strong those muscles are. So we're going to start with your good side over here.
Okay.
So first what I'd like you to do is I'd like to make your elbow straight for me. Good. And then try and raise that arm up as high as you can.
Okay.
Good. All right. So I'm going to have you bring your arm down to 90 degrees, still keeping that elbow straight.
Right here.
You got it. Perfect.
Yeah.
So now what I'm going to do is I'm going to stabilize you on the top of your shoulder. And then I'm also going to palpate the anterior deltoid up here because that's the muscle that performs shoulder flexion. So now what I'm going to do is I'm going to place my hand just distal or farther away from your elbow. And what I'm gonna do is I'm going to push your arm down, and I don't want you to let me push your arm down. So resist my downward push. Ready?
Yeah.
3, 2, 1. Hold, 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 hold. Good. Alrighty. And then we're going to move over to the right shoulder, and we're going to do the same thing again. So if you can make your elbow straight and raise your arm up as high as you can. Alrighty, good. Then I'm going to have you bring your arm down to 90. Good. Again, stabilizing the patient on the top of the shoulder while palpating or feeling the anterior deltoid contract. Then I'm going to be placing my resistance just distal or farther away from the elbow. So then on the count of 3, Michelle, I'm going to push down, and I want you to not let me push you down. Ready? 1, 2, 3. Hold, 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 hold. All right, good. Go ahead and take a break. So for shoulder flexion, the patient presented with grade 5, so that means that they can perform the range of motion and then withstand my maximum push against them into resistance. So the next one I'm going to have you do, Michelle, is we're going to start with this arm again. I'm going to have you keep your elbow straight and bring your arm out to the side like so. Good. Alrighty. Go ahead and bring it down. So now what I'm going to have you do is I'm going to have you stand up for this one actually. Perfect. So then what I'm going to have you do is standing here, we're going to stabilize the vertebral border of the scapula, and I'm going to have you keep your elbow straight and bring your arm up to 90 degrees. Good. I'm going to be applying resistance just proximal to the elbow, and then on the count of 3, I'm going to push down, and don't let me push you down.
Okay, you got it.
Ready? 1, 2, 3. Hold, 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 hold. Good. And then for that one, I was palpating the middle deltoid, and I felt it contract, so that's a good thing. Now we're going to move over to the right shoulder. So again, stabilizing the vertebral border. I'm going to have you bring your arm up to the side as high as you can. Good. And then go ahead and bring it down to 90 degrees. Perfect. Stabilizing vertebral border, palpating for that middle deltoid. Resistance is going to be just proximal to the elbow. And then I'm going to push you down. Don't let me push you down.
All right, you got it.
Ready? 1, 2, 3. Hold, 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 hold. Good. Go ahead and take a break. So again, with shoulder abduction, the patient presented grade 5, so they can withstand my max resistance and move through the range of motion.